And now, your host, Pat Rouleau.
Hello, I'm Pat Rouleau, and you know me, always ready to tackle any healthcare or hospital hazard. And today is a full day with an alarming upcoming hazard, a beautiful guest, and a special edition of shocking news. So find your best seat in the house or car, get comfy, turn off that cell phone. Why? Because right now it's time for the hospital hazard of the week.
Hello? Hello? Someone? Nurse? Can someone help?
Hello?
Help!
Someone? Nurse?
Hello?
Can someone
Someone?
help? Hello?
Nurse?
Help! Help me!
Help!
Stop the noise!
Nurse?
Hello, we're going crazy in here!
This is an alarming problem. Did you know that there was such a list as the Health Technology Hazard List? I didn't either. The Emergency Care Research Institute, ECRI, a Pennsylvania-based patient safety organization institute, released its top 10 health technology hazards and listed hospital alarm hazards as the number one issue on its annual list of the top 10 health technology dangers. With alarm hazards topping the list, the ECRI points out that excessive numbers of alarms lead to fatigue and ultimately patient harm. 19 out of 20 hospitals surveyed ranked alarm fatigue as a top patient safety concern, according to the results of a national survey presented at the annual meeting of the Society for Technology in Anesthesia. Alarm fatigue occurs when clinicians become desensitized to the constant noise of alarms or overwhelmed by the sounds and turn the alarms down or turn them off. The problem has become so widespread that last month, the Joint Commission that accredits hospitals throughout the country named it a national patient safety goal and now requires accredited hospitals and critical access hospitals to improve their systems. Approximately 80% of alarms that go off have no clinical relevance. Imagine that. Here you have patients being awakened by these sounds that they cannot interpret or control, so that raises anxiety and stress levels. And nurses have so many stimuli that they are required to respond to that over time they become desensitized. They don't notice it. They don't necessarily know which signals to prioritize because the alarms are not standardized. You just can't tell which alarm signal is more urgent across the many devices. Hospital staff are exposed to an average of 350 alarms per bed per day, based on a sample from an intensive care unit at the Johns Hopkins Hospital in Baltimore. That translates into thousands of alarms per unit and tens of thousands of alarms per hospital each and every day. Can you imagine working in that kind of noise-filled, stressful environment? God bless nurses and their staff. I can't concentrate if the person next to me is chewing gum. Well, the beeping devices include those that measure blood pressure and heart rate, administer medications, are attached to the bed rails to prevent falls, among other things. Some beep when there's an emergency, and some beep when they're not working. Complicating the situation is the abundance of technology with no standardization for what the beeps mean, misinterpreting alarm signals, too few staffers to respond to alarms, and equipment malfunctions. And cases of patient harm caused by noise fatigue are probably vastly underreported, partly because ignoring or misinterpreting an alarm may have set off a chain of events that led to an injury or a death, such as due to patient falls, delays in treatment, and medication errors. For example, a 17-year-old died recently following a tonsillectomy at a Pennsylvania surgery center. After the surgery, the high school junior was given a potent painkiller that slowed her breathing. By the time the nurses checked on her 25 minutes later, she had suffered profound and irreversible brain injury. She died 15 days later. A nurse said in her deposition that the alarm on the respiratory monitor was muted. In another case, an elderly woman's heart rate monitor beeped unnoticed by staff for several minutes. Her nurse was preparing medications in another room where she could not hear or see the patient in the monitoring room. And by the way, the hospital had cut the position of the technician whose job was to monitor alarms at a central station. So by the time the nurse responded, the patient had suffered, again, irreversible damage and died shortly afterward. And just as a side comment from me, this doesn't sound like an alarm problem, but rather a staff shortage problem. How was that nurse expected to care for one patient and attend to an alarm that couldn't be heard? And yet in another case, cardiac electrodes became disconnected from a patient who fell getting out of bed, triggering a specific alarm that usually indicates that the wires are not connected. Medical workers discounted it because it was considered a low priority. No one responded until housekeeping staff discovered the patient on the floor 30 minutes later. And then, by that time, clinicians were unable to resuscitate the patient. So what's being done? Well, last month, the Joint Commission, again, the group that accredits hospitals, directed facilities to make alarm safety a top priority or risk losing their accreditation. The Commission is requiring hospitals to identify the alarms that pose the biggest safety risks by unnecessarily adding noise or being ignored. And by 2016, hospitals must decide who has the authority to turn off alarms. Sounds very strange to me. In some hospitals' non-intensive care areas, officials have been implementing what's called a no-pass policy, meaning that no employees, from housekeepers to administrators, should pass by a patient's room if they hear an alarm. And that takes me back to the days in the hospital with my mom. Sometimes those alarms would beep forever. Nurses and aides would walk by and keep on walking. Hello, can you turn this thing off? We're going crazy in here, and my mom can't sleep. In fact, a recent study from the University of Chicago found that average noise levels in a hospital room easily exceeded the 30 decibels recommended by the World Health Organization, and that peak noise levels sometimes approach the level of a chainsaw. Not surprisingly, patients in the loudest rooms suffered the most, losing as much as an hour or more of sleep a night compared to those in the quieter rooms. And for every hour of sleep lost, the patient's blood pressure increased by as much as 6 points. A study published more recently looked at the brain wave and cardiac responses to isolated hospital sounds, like an ice machine dispensing its ice cubes, or a laundry cart rolling, an IV pump beeping, people talking in the hallways, pagers. And then they calculated just how disruptive those sounds were to patients who were asleep. The researchers found that while the responses differed depending on the stage of sleep, people were more consistently aroused by the electronic alarms from monitors and infusion devices and the ringing from telephones. Each time they woke, their heart rates jumped. And then this takes me to another obstacle in the quest for quiet. It's not the machines sometimes, but rather the approach to patient care in many hospitals. Doctors, nurses, and other members of the hospital staff often wake patients up in the middle of the night or during the afternoon nap to assess a non-urgent blood pressure or temperature, or draw blood or administer medications that could actually be safely done and delayed by a couple of hours. Sometimes, and in some places, it seems that everyone in the hospital tends to do things at their own convenience instead of working together as a team to figure out what might be the best for the patient. Yes, I know it's not a hotel. However, my mom endured many instances when she was awakened at 3 a.m. to give her a bath to save time for the incoming morning staff who likely were going to be understaffed, or so I was told. Well, I don't claim to have the answer to this, but as a patient or as an advocate for someone in the hospital, be aware of noise pollution and noise fatigue, especially when it comes to alarms. Ask what can be done to reduce the amount of alarms in your room. Ask for an explanation of the alarms in your room. Most patients don't know that a 1 beep alarm is not typically as urgent as those with 3 tones or 3 beeps. Ask the staff to group non-life and death actions such as bathing and blood draws into a single visit and not in the middle of the night. The quieter your environment, the better your outcome with fewer complications. Now, that's just a small solution that should not be alarming.
We're going crazy in here.